Yeah, so welcome to the ETF Regional Research Updates. This event is for Africa and Western Europe. Okay, so if I can draw your attention to the slide in front of you, this is the housekeeping slide. So if you look to the very far left, that's your mute and unmute for the purposes of this event. If you could stay muted unless you're speaking, yeah, we'd appreciate that. You will be able to see who's joined with the participants. And then further to the right, there's the chat box. This is where you can put your questions for the Q&A. You can ask us for support if you're struggling with any tech issues. Yeah, just generally have a chat with us, and we'll be posting vital information in there ourselves. And then if you look the furthest to the right, there's now an interpretation function. We have got this being interpreted in French. So if you are interested in hearing the French version, then please go to that and click French, and that will put you into the French channel. If you do want to listen in English, then just click the English channel, and that will enable you to hear it in English. So I'll go through a brief agenda. So I'm Kerry. I've just completed the introduction and housekeeping. I will then pass you on to the fabulous Nick Crofts, who will do the welcome and introduction to the ETF project as a whole. Then we will hear from Munya Katumba via Melissa Jardine, who is the moderator for today. Then we will hear a fantastic 30-minute presentation from the updates from Africa, from Munya. And then we will be introduced to the lovely Dr. Michelle McManus. We'll hear her presentation from Western Europe. Then we will lead to a Q&A, which will be supported by myself and the Inish team. And then we'll hear the closing remarks from Nick. I'm just going to add, due to some sort of technical issues we had this morning, it may be subject to change regarding the Q&A, but we'll talk to you about that as we go. Okay, so enough from me. I'm going to hand over to Nick Crofts, who do the welcome introduction to ETF.
Thanks, Nick. Thank you, and good evening, good afternoon, good morning, wherever you are. Welcome to this webinar from the Global Law Enforcement and Public Health Association. Can I change the slides, or are you changing the slides?
Yeah.
There you go. The Global Law Enforcement and Public Health Association, like many other people around the world, has been concerned about the discussion that's going on, debate that's going on about the role of policing in modern society, and issues, particularly in the United States, but in other places as well, have thrown up all sorts of questions about what is the future of policing and law enforcement in general in relation to assuring public safety, and particularly from our point of view, building a platform for the health and well-being of whole communities. We're therefore embarked on this research program. We're looking systematically across the world for examples of initiatives where people are looking for alternative ways to approach these complex issues that bedevil modern societies. We're showcasing the results of that research so far in a series of 3 webinars, of which tonight is the first. We're working with researchers, research colleagues in 6 regions around the world, and the way we're presenting this section of the research is by looking at two regions per webinar. So you can see there in front of you the researchers that we're working with. They each have responsibility for a huge swathe of the world, and it's a great challenge trying to connect and find initiatives where people are trying to find new ways, different ways of approaching these issues. Tonight we're hearing from Michelle McManus, whose responsibility is UK and Western Europe, and Munya Katumba, who is looking at Africa, mostly sub-Saharan Africa, and developments in policing and thinking about approaches to public safety in those regions. The next 2 webinars will have presentations from Mo McGough in North America and Jaime in Latin America, and then the third one, Erkin, and in Eastern Europe, Central Asia, and Kusanafong Putakul in Asia and the Pacific. I don't want to say too much more about it because the researchers' work will speak for themselves, but I'd like to introduce our good colleague at the Centre for Law Enforcement and Public Health and the Global Law Enforcement and Public Health Association, Melissa Jardine, who will moderate the session with our 2 speakers and then our question and answer sessions. thank you very much. And I look forward to hearing from our researchers.
Thank you so much, Nick. And it's a real pleasure to be here for the first of a series of 3 webinars covering the 6 regions. And I'm looking at the audience and the people that have joined, and I can see many friends and colleagues from across the world. So thank you so much. It's really nice of you to join in and to support this work. So I certainly hope that we'll have lots of interesting questions by the end of the session. So I'm introducing our first speaker. It's Munya Katumba, who's our researcher for the Africa region. And Munya is a research consultant for the Centre for Law Enforcement and Public Health, for AIDS Funds and COC Netherlands and others. He's very busy. Munya has 17 years of experience in managing health-related and business development projects and programs with both the private sector and civil society organisations, working in Southern Africa, Central, East and West Africa, including Anglophone, Francophone and Lusophone countries. His expertise spans HIV/AIDS, law enforcement training on human rights and key populations, sexual reproductive health rights, governance, business, organisational development, business startups and more. He's leading a review of the Southern African Regional Police Chiefs Cooperation Organisation, SARCO, their health, HIV and AIDS policy, development of a training program and its implementation. He led the development of South African Police Service Dignity, Diversity and Policing training program on human rights and policing vulnerable groups. And he's been instrumental in the implementation of the guidelines of the conditions of arrest, police custody and pre-trial detention in Africa. Now, Munya has gone to great lengths today to join us because there has been a power outage where he is. And so we're hoping that we can continue with his presentation without it dropping out, but, you know, be prepared for the potential for interruptions. So Munya, please, thank you so much for going to the efforts that you've gone to make sure that you could be here, and the floor is yours. Thanks, Munya.
Thank you, Melissa, for the introduction to everybody. Good day, everyone, wherever you are in the world. I've already been introduced. Munya Katumba. The work that I also cover within Africa is also been stated. Thank you for having me today. The presentation that I would do today mainly would cover the situation regarding law enforcement and public health collaborations and partnerships in Africa. And as already mentioned by Nick, the majority of the examples will be from Southern Africa, but we're also looking forward to also do quite a lot of research around the West Africa, East, and so forth. We'll also cover who drives and leads these law enforcement and public health collaborations. Do they work well? If they work well, what is working well and why is it working well? Are there any issues, problems or challenges within these collaborations? And then also, I'll have a chance right at the end to also give you some few examples that we have come up with within Africa, and particularly Southern Africa. So regarding the situation of collaborations, we have seen that most of the collaborations are in the area of responding to epidemics and pandemics as it relates to mostly HIV and AIDS, sexual transmitted which are STIs, around tuberculosis, malaria, as well as COVID-19. We've also seen some collaborations responding to gender-based violence, especially as it relates to setting the agenda, and as well as policy formulations and reviews to ensure coverage on issues around gender-based violence. There have also been quite a lot of collaborations responding to socio-economic challenges that countries face, as well as in some other countries we've seen there's been counter-insurgents or responses to terrorism, especially when it happens within civilian spaces, responding to either cases of rape, cases around diseases, as well as also civilians dying as a result. The situation, I think, whether it's working well, we have seen that there are some collaborations or partnerships that are working very well. But this is also depending on the long history and experience of those partners in working together. We've also seen that those that work very well, it's either they have a common goal to achieve within their local communities at national level, or when they want to achieve global health outcomes. But also based on this, we've also seen that there is quite a lot of antagonism as it relates to civil society organizations. Mostly you would find when there's a situation on the ground or there are problems, usually the blame is put on law enforcement. I will elaborate more on this point. Also, law enforcement perceive civil society organizations as enemies of the state, as it relates that most of these CSOs, they are the ones that, discuss and put around some of the issues that come out. As a result, they are always perceived, especially when there is antagonism, as an enemy and not collaborating with state entities. We've also seen quite a lot that, as it regards to law enforcement and vulnerable groups, what we also call key populations, that you see sex work, LGBTI, and issues around drug use are criminalized. So law enforcement, therefore, always say you are criminals and we are here to enforce the law, and therefore you should be arrested. Sometimes issues are discussed within civil society or any state and non-state actors, and for years there will be no results. So usually you get that the collaborations and partnerships always do not go well, because of things that remains the same over a period of time. In terms of who drives them, we've seen that they've been government to government or government departments and law enforcement, especially as it relates to collaborations within governments or departments. A good example that we've seen is Botswana main sector. It's actually a collaboration of government departments with the security sector within Botswana, where they come together, discuss issues around health, issues around HIV and AIDS and so forth. So this is actually a very good example of government to government collaborating within Botswana. We've also seen government and law enforcement, especially through the multi-sectoral HIV and AIDS, TB and STIs response within the countries, where CSOs and other partners within a country come together, especially to achieve either UN or WHO health outcomes, or strategic development goals and so forth. Within civil society, we've also seen quite a lot of leading as it relates to issues around human rights. They bring them up, and they always make sure that they are on the policy agenda, and they discuss also issues around key populations and issues of violence, gender-based violence, issues around abortion relating to girls and women. So these are some of the areas where we have seen that civil society, they are experts in this area, and they always lead the partnerships and the collaborations with the various partners, whether there is the state or private sector. Within the region, there are also regional bodies. For example, the Southern Africa Regional Police Chiefs Coordinating Organization. They also come together within their 16 member states, which comprise of law enforcement agencies, to either develop training programs or either looking at issues around police health and so forth. We've also seen within the SADC, the Southern Africa Development Commission, on issues around HIV and AIDS, also responding to terrorism and insurgents. Of late, there have been quite a lot of issues in the northern part of Mozambique, where countries have come together, especially the security sector, to look at some of these issues. We've also seen, the East Africa, the COMESA within ECOWAS within West Africa, COMESA, as well as also East Africa. Regional bodies also come together as it relates to insurgents around either, in Nigeria, Al-Shabaab, as well as also back in the day when the Lord Resistance Army was, also there. So these are some of the areas. Within the United Nations family, we've also seen quite a lot of peace-building missions in Sudan, Eritrea, Democratic Republic of Congo, and some other African countries where law enforcement agencies actually collaborate with other security sectors to respond to issues around policing or issues around building or bringing back the rule of law within these countries. There's also quite a lot of collaborations with the UN family as it relates to policing around vulnerable groups within communities. There have also been quite a lot of challenges. And what I will do is I will specify them. I will talk to you about why collaborate with law enforcement around issues of sexual orientation, gender identity and expression, as well as also drug use and sex work, as these are some of the 3 key points around key populations of vulnerable group that have come out very strongly within Southern Africa, why there is need to do so. So in terms of same-sex or sexual orientation and gender identity, we've seen that in the majority of countries within Africa, they perceive these populations as criminals, and therefore the law should be enforced harshly. And we've seen some collaborations within either civil society organizations and law enforcement, especially police services, in building or developing some training materials so that police are able to cover issues around diverse communities on how they should be policed when they put them into custody or when they are arresting them and so forth. We also talk to law enforcement, especially the civil society, because of the laws that criminalize same-sex relationships. We strongly believe that everyone is equal before the law and has the right to equal protection and benefit of the law. Therefore, when laws are being enforced, these issues around human rights should be considered. There have been also a lot of hate crimes because either someone is a member of the LGBTI community, or someone is a sex worker, or someone is or whether people are just homophobic. For example, in South Africa, for the past 5 weeks, there's a statistics that there have been already 8 deaths within South Africa. And this is just within 5 weeks. There are also further statistics that can be shared with these other African countries that this has been quite an issue. So therefore, police officers should be able to cover such issues. We're not saying as civil society or law enforcement that criminals should not be arrested, but we're saying when you arrest criminals, it should be done in a humane way. Either standard operating procedures should be followed. Also, as it relates to maybe issues of infrastructure, that certain members of the community, because of their vulnerability, might be they might be need to put them in certain areas of holding them when they are in detention. And then we'll go further to discuss, issues around drug use. And in most cases around drug use, I always share this global trafficking route for cocaine. There are also several of them. If you look at please move to the next slide. If you look at this, it shows that this is a big business, and drugs are being trafficked in all the areas, within the world. So it is key for law enforcement agents to know that this is happening. And this slide is also key. And in some trainings, I use it because to show the magnitude of the problem or the magnitude of trafficking, and asking police or law enforcement whether they are not aware if big ships are being, traveling around the world and so forth. Next slide. And also, I think it's key to talk to law enforcement about drug use, because in some cases we have seen that, for example, with injecting drug users, that those needles that have been supplied by either departments of health or civil society organizations, they're also being used as evidence that an individual is using drugs. So we always try to make sure that, law enforcement, they know when we are collaborating with them that they are also contributing to health outcomes. Because if a drug user is afraid of walking around with the needles, they are likely to make a decision not to carry them around and share, which might increase the HIV prevalence rates and incidence rates. So it's important that the decisions of law enforcement and how it relates to new HIV infections, therefore the need to collaborate and share information about this one, so that when police act, they also act in the best interest of contributing to broader health outcomes. As it relates to sex work, slide number 14, as it relates to sex work, you find out that in most communities, sex work is regarded as immoral. Therefore, it actually drives them underground, the way they work, as well as also the way they make decisions that relates to their health and so forth. So we always want to make sure that civil society and law enforcement agencies or the state actually partner to make sure that some of the decisions and some of the laws that are criminalizing sex work, the impact that they have on these individuals, and then also the impact that they have on socioeconomic or disease, and therefore. The next slide shows that as it relates to sex work in Southern Africa, it's actually, I use it deliberately because, it shows red all over, right? Meaning some of those issues, they actually need to be prioritized. It relates to, unsafe working environments, violence and rape, also challenging relationship with law enforcement as it relates to engaging in illegal activity, because we've also seen, especially with the research, that law enforcement, in most cases, they actually either ask for sexual favors from sex workers so that they can release them, or they confiscate condoms, which are tools that they use when they're doing their work. There's also a lot of issues around rape and violence. It's also perpetrated by law enforcement. Therefore, the need to ensure that there is strong collaborations with these institutions. In summary, yes, we see that there have been quite a number of problems. Laws criminalizing same-sex, laws criminalizing sex work and drug use. We've also seen that there are issues around civil society organizations and CBOs. Those are community-based organizations perceived as enemies of the state, as well as also they are perceived as promoting immoral behaviors, or they are perceived as if they are, persuading or implementing the Western agenda. Therefore, there've been also a lot of backlashes, which also needs very strong partnerships, so that each and every partner understands the either the health or socio-economic impact of some of these decisions that states and law enforcement make. We've also seen that in terms of rigidity, bureaucracy. Also, state actors, law enforcement, they are protocol driven. lengthy processes and so forth, which causes quite a number of issues, especially when they are working with other actors, especially civil society, because civil society might not understand some of these issues, because projects, as we understand them, they are time-driven. You need to produce results. So therefore, you find out that most civil society also end up either giving up because they don't understand the processes, or if they are not explained to them, they just simply give up, as I've said. We've also seen that there are also issues, especially as it relates to missions, as it relates to some of the missions, especially when they are using force. When law enforcement is using force, especially maybe in war zones and so forth, or at least they are supposed to go there and bring accountability or security to the nation. There have been also a number of, I'll just simply go through it because of my time. There have also been quite a number of benefits to why these partnerships work. For example, improved employee wellness as it relates to, police officers, because either other partners like civil society, private partners, they also bring in their expertise to ensure that there is improved knowledge, there is improved attitudes and practices of law enforcement as it relates to other or enforcing the law or policing around vulnerable groups and so forth. They've also been improved quality in some sections where law enforcement and civil society have engaged, because they now understand each other in terms of the key populations and so forth. So we look at also issues around sharing best practice. We have seen countries like Mozambique, South Africa, also, engaging with, for example, the Dutch Pink and Blue in understanding how vulnerable groups are policed, or even within Southern Africa, there's also been quite a number of discussions that have started at the level of SAPCO, which is also promising in terms of these partnerships. Some examples, that have been very good. For example, in Southern Africa, we do have a program where law enforcement, especially the Metro, as well as South African Police Service, have engaged with a group of drug users as it relates to, harm reduction. So we've seen that police have actually been outstanding in providing a service to drug users. In Mozambique, police have been very instrumental in bringing also addressing issues around violence perpetrated by law enforcement against sex workers, where they've, in 11 provinces, come up with a gender desk. And also, at national platforms, they've created a platform where, sex work, NGOs, government departments, ministries of health, the Ministry of Interior come together and discuss issues around, implementing key populations or vulnerable groups, also contributing to national health outcomes and so forth. In Kenya, we've also seen quite a good number of programs also relating to sex work and policing around gender-based violence, sexual orientation and gender identity and so forth. As well as also countries around, Liberia and Sierra Leone, COC Netherlands, together with the local partners there, they've also been addressing issues around sexual orientation and gender identity with the security force. We've also seen quite also a good number of, like especially countries like Ghana, Nigeria, Uganda, and Zambia, addressing issues around abortion. As we know that it's criminalized in most African countries, so therefore the NGOs, especially through IPAS, have been also documenting some of these issues and also building materials to train law enforcement. And there've been improvements in making sure that either the girl child or women access services when they choose, especially to abort, or, when either they are forced and so forth. South Africa has also had a very good example of a program that they are implementing under their dignity, diversity, and policing, where they developed training materials for police. Although the number of police officers are still small, but there's been some progress around policing vulnerable groups and so forth. And I think also a good example around COVID has been Zimbabwe. During the COVID, police and the security sector were actually asked to partner with government hospitals by sending their health practitioners to help in especially on issues around COVID, which is not documented anyway, because police were always seen as, the bad guys who were forcing people, to comply and so forth. So this is actually a very good example coming from Zimbabwe and so forth. And then the last one, I think I've also given you more information where some of the countries, either under the UN peacing missions, police and law enforcement have been collaborating to bring either the rule of law or to ensure that services are rendered to those vulnerable groups within the war zones and so forth. Thank you very much for listening, and I look forward to questions.
Thank you so much, Munya. That's fantastic to get such an overview of obviously a diverse region. I should also note that our project runs for until October, and we're still looking for people to suggest initiatives for us that we can showcase. We're looking for collaborations between law enforcement and public health, as well as initiatives that are alternatives to policing. And so you can email those to us at info@glefa.com. I'll put that in the chat as well, because we still have time to add to the specific examples where we can try and draw out some good principles of what we're looking for. And, we really need your help to try and get some more coverage of those. So we'll add some details of that in the chat. But I would like to just throw to some questions. Firstly, do we have any hands up? Maybe I'll go to Nick first, and we do have something in the chat as well.
Melissa, I've got so many questions. I don't want to dominate, but one of the things that's coming out of the research, and I certainly feel it listening to Munya, is the different dynamics in different regions and the roles of police and the autonomy of police in different regions, that in some places and at some times police are able to assume a leadership role in adopting progressive approaches. In other places, they're not. And I hear coming out of what Munya has been looking at, the relative, firstly, lack of identification of police as having a role in the public health enterprise, firstly, simply being seen as law enforcers. And then secondly, the need to change the law and the legal situation so that police actually have got the opportunity to respond in different ways. All of which is leading me and a lot of the discussion that we've been having within the project to think that, well, police can have leadership in some areas, but I want to ask Munya, to what extent is it possible for police to take the lead in situations where behaviours are criminalised such as HIV transmission or abortion or petty offences, or all the sorts of things that you have been seeing in your work in Southern Africa? To what extent can we expect police to take the lead, or should we be just working with politicians, community, and targeting much more on the decriminalisation or challenging criminalisation?
Right.
Right, should I take the question?
Yes.
Okay. All right. So, Nick, thank you very much for the question. You see, the role of police has always been very instrumental as it regards to, providing a service to the citizens of a country. And we have seen that there are certain behaviors that are criminalized, as I have shared, in terms of drug use, in terms of, in some cases, maybe even HIV, in some cases, same sex. And it has been very difficult because police always tell you our role as police officers is to enforce the law. And when you try to partner with them, they always say, please go to the policymaker. But also, so back in the day, you'd find out that there was a lot of antagonistic, going on between, the law enforcement as well as some of these communities. But in actual fact, the police can take a role because civil society then can change also their narrative to say, it based on, the knowledge, attitudes, and practices of police officers, they can actually, change, even if the laws still criminalize, they can actually change because they are there to save communities. So in most cases, what we have seen to work is either to use a public health approach and a human rights approach. So in cases where you have to use a public health approach, you approach the police, do research with them in terms of their knowledge, attitudes, and practices on a subject matter, and then also prove to them that based on your actions, this is the repercussions, this is the impact that is causing, and then also try to compare, the global health outcomes and then how law enforcement are acting against achieving this global law outcome. So we have seen that this is starting to work because then when the law enforcement see the statistics and their impact based on the actions and the way they arrest, they therefore say, okay, there is need to act because this population that we are also talking about, or these communities, they are an extension of the police themselves. And then on human rights approach, we've seen that what we are asking police to do is not to say you're not arresting criminals. Arrest criminals, but when you are arresting the criminals, make sure that you use, you abide by the law, you use your standard operating procedure, and making sure that you maintain human rights of either suspects or those that are being suspected of, criminal activities and so forth. So we have seen that these two approaches, the public health as well as the human rights, is making some huge impact in making sure that the police themselves lead. We have seen that in South Africa, that the police are actually leading in making sure that they implement human rights programs. They also, implement certain programs so that they can contribute to global health outcomes. We've also seen that the subject is also being, starting to build up, especially at regional levels. For example, at the Southern Africa Regional Coordinating, which is an organization of 16 Southern Africa law enforcement or police institutions. So I've seen that police are starting to take a role, and although difficult, but it's starting to happen. Thank you.
Munya, if I can just follow up, Edwin has put in the chat, I don't know if you can see it. Can you see the question in the chat? Something that challenges what you've just been saying very strongly. And I just wonder what your reaction to it is.
Maybe we could ask Edwin to,
can you comment?
Maybe could Edwin unmute himself and ask the questions himself. That might be the best way. Please go ahead.
Yeah, thanks very much, Melissa and Munya. I mean, really, one of the real problems now is the, particularly in South Africa now, is this new COVID criminalization law, and there is this circular for the South African police that we saw last week that says that even police turning up to work who have a positive COVID test would be charged with attempted murder. And I mean, if the police are going to be charged with attempted murder themselves, how might this impact how they treat key populations and people living with HIV?
All right, so I haven't seen this particular circular that is going on. And I'll not be able to comment exactly because I need to read it. But in terms of policing the vulnerable groups, as compared that they are now treating the same police officers as committing murder and so forth, like I'm basing on what you are telling me. As it relates to key population, they will continuously, because what we have seen, especially in South Africa, they've developed standard operating procedures for policing around sex work. You know, they still call it, you know, in their documentation, prostitution. So they've put a standard operating procedure on policing sex workers. They put a standard operating procedure on policing drug use as well as LGBTI. So they now have a standard of doing it. So that would be my quick response to your question. But in terms of the COVID, I think I still have to follow up with employee health and wellness and get to know and provide. So maybe we might provide some more information either on the Center for Law Enforcement website or Global Law Enforcement following this. Yeah.
Can I just say quickly, Melissa, that any questions that are put in the chat that we don't get an answer to here, we will follow up and answer and have a response to after the webinar. But Edwin, I think you touched exactly the point that we set up this whole process about, which is not seeing issues like this as being public health issues, but seeing them as criminalisation and law enforcement issues. And that's exactly what the project is about trying to change. So thank you.
Yeah, thank you. And I've just opened that circular, Edwin, and yeah, I mean, it's really fascinating. I haven't got to the line about them being charged with murder yet, but yeah, you know, coming to work and not disclosing the fact that you've been informed of having a positive test result is, you know, being inconsiderate, nonchalant in the extreme, ignoring other health and safety warnings, advice, policies, etc. So there's more there. It's in the chat. It's actually quite interesting. I look forward to reading it in more detail. I think we will move on to the next presentation. So thank you. Please continue. Oh, thanks. It's in the last line, is it? I'll have a better look. Thanks. We'll continue and there will be more time for questions at the end. So please continue to put them in the chat. I think that's a great way that we can keep track of them. So our next speaker is Dr. Michelle McManus. She's the Head of Criminal Justice at Liverpool John Moores University in the UK. Michelle is her work involves exploring areas such as child criminal exploitation, children safeguarding, domestic abuse, multi-agency working, early intervention and prevention, and more specifically on county lines exploitation and serious youth violence risk. Michelle is also the co-convener of the Global Law Enforcement and Public Health Association Special Interest Group on Law Enforcement and Emergencies. And the purpose of this GLEFA-SIG is to explore the roles and challenges experienced by law enforcement during health emergencies, particularly those caused by infectious diseases. Prior to her current role, Michelle was the National Research Lead for Public Health and Policing at Public Health Wales, leading the evaluation for the Early Action Together program on police and adverse childhood experiences. Thank you very much, Michelle, and the floor is yours.
Very much, Melissa. I think some of that sounded like tongue twister words all together. So I appreciate the very nice introduction. So thank you very much, everyone. So good morning, good afternoon, good evening. It's nice to do one of these presentations during the day. In my time, I think the last meeting I had was at 11 o'clock at night. So feeling a bit more awake. And thoroughly enjoyed Munya's presentation, and we'll touch on some points as I'm going through. So I'm hoping everyone can see my screen as I start going through the presentation today. So the first thing, just a thank you to Amy Stanley Hughes that's assisted me with collecting some of this work. And the reason why it's been such a big project here in the UK and across Western Europe is because of the amount of projects, particularly during and as we sort of emerge from COVID, that really focused on community safety and well-being. And again, some of the considerations that we've done in approaching this project is around looking for that evidence, and particularly what our considerations have been in sort of highlighting some of the projects today has been around those that have got evidence of evaluation activities as well. We are also kind of looking for things that have showed some great innovation, so doing something that might be slightly different on smaller scales and on larger scale studies as well. So as Nick and both Melissa have highlighted today, we are still very open to projects being received. We have now a spreadsheet, as Munya shows on his slides. We've collected over 45 individual projects. And some of them are on a national scale, which just include one little row, but has a number of initiatives that then obviously come off that. And I'll be touching on some of them today. But please just get in touch. And if your project is not mentioned today, that doesn't necessarily mean you're not included in our evidence gathering. We've just selected a couple of studies to highlight today. So just going on to some of the focuses of the collaborations, because my focus today will mainly be around some of those examples to really bring things to life. So some of the key things that we found is going through, and again, you'll see some synergies with what Munya has been talking about in Africa, which is the focus certainly in the UK and wider across Western Europe, is around violence prevention. A lot of this tends to be on child exploitation and violence against women and girls. And I'll be extending on this a little bit more in some of the examples. Trauma-informed practice and approaches, the Law Enforcement Public Health Conference, which I know many of you do attend, that also seems to be highlighting this real shift that's happening, not just in Western Europe, but globally around this, more informed around understanding things such as adverse childhood experiences, so ACEs, and how you can bring that into practice with those people working on the front line in all sectors that deal with vulnerability. Linked to this really nicely is also around multi-agency and partnership working. I think Munya highlighted quite a lot of work as well that's being done in Africa, and it's certainly the case within Western Europe and particularly in the UK, around this need for expertise across a range of sectors and how we can better collaborate law enforcement and public health in that partnership collaborative approach. And this has been much more formalised within the UK as well. Again, I'll be touching on this in some of the examples later on. Not a sort of new initiative really, but certainly a very common theme. However, what we've seen in terms of the work that's being done around mental health and domestic violence co-responses. So what I mean by that is a lot of this is actually driven from out of America. There's much more publications on this and evidence in America, not so much from the European perspective. They tend to be smaller studies, which is around, for example, the domestic violence of when you have a 999 call for a domestic violence incident, and then you also have what we call in the UK an independent domestic violence advocate that may also attend with that police officer or law enforcement officer as well, and is there from a victim perspective in terms of support, and similarly around mental health and how we can do more around the diversion with having sort of mental health nurses or practitioners that co-respond. I think in terms of substance and alcohol misuse, we've seen a bit more increase in this in terms of the shift. So what we've seen before, we certainly had a key theme before COVID around substance and alcohol misuse, but this was more centred in the nighttime economy. What seems to have happened, and a lot of publications have done this in terms of just community wellbeing and awareness raising, is around alcohol misuse and substance misuse within the home, and how that seems to be a focus with initiatives going forward. A big one that often gets missed out is around workforce wellbeing as well. And I know, again, Munya touched on this from an Africa perspective at the end of his presentation. It's something that has been recognised again, particularly post-COVID, about how we can ensure our workforce is at the centre of some of the work that's being done, being the frontline workers that are often in touch with these people that are the most vulnerable in our society. And alongside this, around community recovery, and again, particularly this is becoming things going forward. So I think as well, what I found really interesting is we've kind of pulled out some of these key themes that are working well. And again, we're very simplifying some of the findings that are going here for this presentation today. But what's interesting around this is that there certainly seems to be echoed across a lot of the Western European areas that we've looked at is this awareness, this acknowledgement that you cannot arrest your way out of this. And this is seen at all levels. So this is a mantra that we see at those very top senior government levels and also from those practitioners that are out on the ground. Obviously, this varies across those different countries, but it certainly seems to be something that is echoed as a very common level. And again, as I just highlighted there, we've got some great buy-in from cross-government and ministers and leaders within this. And I will pull out some examples from the UK on this particularly. Most of the initiatives involve multi-agency practitioners and expertise. Out of the sort of 45 that we've got within the spreadsheet at the moment, I would say about 43 of them, when I did the last count, have that very evident multi-agency representation and expertise within their initiative and their approach. So it certainly seems to be a key thing going forward, is that recognition that there is a need for all those expertise to come together in decision-making, planning and action around that. Change of language, again, this is something that we're seeing very much echoed, I suppose, when we're reflecting on those top ones around the kind of government buy-in and that ministers and leaders and how that is communicated. It's really important to consider language, that this can help change those cultures and those traditional responses in silo working. And there are still some issues around that, which I'll be highlighting in the slide, but certainly there is a motivation and a drive around this change of language. And this acknowledgement of a need for an evidence base is also really important. Much more, I mean, when I started doing a lot of work with law enforcement many moons ago at the start of my master's, a lot of the time you would get very frustrated that you would be brought in to do a piece of work as a researcher when a programme had come to the end. A lot that seems to be changing, certainly taking this law enforcement and public health response, is considering evaluation right from the start of the project. And that needs to be very transparent in disseminating those findings going forward as well, is an important feature going forward. And then this idea of the importance of user voice in the design and creation of initiatives is now seen as a key feature in a lot of the Western European projects that we've looked at. So ensuring they've either got a group that's involved with that, or they're working with data that really does delve into some of the user voice within that. So just on that, I mean, just out of curiosity, and please put this in the chat because I would love to come back to this later on. Out of those 6 points that I've just highlighted there, just number for me if you've experienced any of these that you think are working particularly well. So if you want to highlight one of those, or if there's anything else within that list that you think is working particularly well, are driving change and effective working towards community safety. And it would be really nice to come back to chat about this and reflect on that as we're going forward. So just put in the chat any numbers and anything you think is particularly working well, that would be great. So problems and challenges. So it's interesting that we talk about some of the great work that's going on, and then obviously where some of the issues and challenges can come from that. And this is key for, I think, every global country. When we start talking about bringing all this work together as we go forward as part of this project, is this idea of unrealistic short-term data indicators and measures. And it does tend to be linked a lot of the time to government funding or initiatives. And it's about how we do engage in those real-term impacts, that softer and that longer-term work and those benefits that we see that will be outside the remit of that funding. So some of the frustrations that we often hear, particularly when speaking to people about these projects and these initiatives, are the issues around trying to ensure they've got those indicators and measures ticked as part of their funding requirement, but also how can they actually do the real work and show the real impact in that. And there's often a bit of a conflict around trying to do that effectively. There's also a lot of conversations that we've had with people, and some of the data, certainly recommendations from a lot of the reports that have been shared with us, which is a lot of the challenges tend to be because of this targeted funding and interventions. So what we often hear is that the money tends to be targeted, and it could be rightly so, at those that are seen to have the worst issue. For example, say it might be around knife injuries. However, it's not understanding some of the connections around that, those areas that sit outside of that, and the other more broader vulnerabilities that lay in other areas that might be building towards a much more complex issue. So again, it's just about how do we ensure that that funding is done in a shared way that allows some of those findings of that work to be given to those areas that might not be seen as the most problematic. Certainly from COVID, and again across Western Europe, there's been a real concern around some of the funding that's been removed from universal services. So there are concerns around a lot of the schools, early family healthcare and community support and safe spaces, as this has always been decimated a lot during COVID. Those active youth clubs that used to be these safe spaces for young people, trying to build up that community resilience. There's been some real concerns about some of the projects that have over years built up some great networks in their communities, about the dangers of that and going forward, and how they can then again build up to those targets and activities that they had in those areas beforehand, and how do we recover from that going forward. And as I mentioned before about what's working well is this idea of language. What we've also got is certainly an acknowledgement that there is an acknowledgement, certainly in documentation, in policy, from a very government-led perspective, but actually how do we put that into action? There is still recognition across Western Europe around a lot of the reports tending to repeat many of the findings, with universal services being an example of one of them. So how do we break that cycle? How do we stop what is just report after report having the same recommendations and actually make those changes in society? What it tends to rely on, what we've seen, is that it's the local work that tends to happen for very small local areas. So I'm not even talking from a UK or an England perspective, it would be from a very small local area that will take some of that initiative and drive it forward. And that's almost what we seem to be depending on here. So again, just reflecting on this from your perspective as the audience today, you know, are there problems? So if we look at 1 to 4, what would you say the key issues that are the most problematic when trying to create your community safety within your area? Is there one that particularly stands out for you? And are there other issues, again, just reflect on the chat for me, that you're certainly experiencing, and we would love to hear what your perspectives are on this. So going on to some case studies now, just to give a bit of a flavour as to some of the stuff that we've managed to pull out so far in the project. And as Melissa said, we've still got a few months to be collecting some more data on this. So one of the biggest things that I obviously had to pull out within the United Kingdom is around violence prevention, and a real focus that we certainly have around this. So the serious violence strategy, which was developed in 2018, so again, reflect on some of that good work that I talked about before, that real top level drive that's happening certainly within the UK, and that onus on partnership working that was really pushed within that serious violence strategy, along with a ton of money to fund some of the work in this area. So what we initially had was around 35 million as part of an initial kind of funding for 18 out of the 43 police forces to establish violence reduction units. And they were stipulated to have a core function in providing leadership and strategic coordination of all relevant agencies to support a public health approach to tackle serious violence and its root causes. So right in its outset, you can see in terms of our remit of looking at public health and law enforcement, violence prevention, and looking at the violence reduction units was obviously a key place to be going to. The VRUs, as they're called, they've sought to bring together different organisations to tackle and understand root causes of violence. They were asked to work specifically with existing partnerships, so really try to make the most of those local organisations in developing a more prevention and focused-based holistic approach to serious youth violence. It did come from a lot of work that had been done, particularly from Scotland. So again, I'm more than happy to share the slides, but what will be worth highlighting is there are a ton of links in this that you can go off and look at a lot of the stuff that the research that we've highlighted. So the Scottish Violence Reduction Unit, you can go into their website and have a look at a lot of the work that they have already done. What's interesting is that certainly the Hughes definition of a public health approach was seen as the driver in a lot of the documentation and guidance for the VRUs. With this idea of having 2 mandatory products that they initially had to do, which was a problem profile or a strategic needs assessment, which was basically to identify those drivers of serious violence in their local area, and also identify those cohorts of people that were most affected. They were also required to, on the back of this, develop a response strategy, which basically describes a multi-agency response being delivered by the VRU and its partners to tackle those that were found within their problem profile. What's interesting is there's a couple of, and it's a very tiny link at the bottom of the screen, there is some evaluation work that's already been done on the violence reduction units, with further work being published going forward. Obviously, with that much money, it's really important for transparency in terms of what they are achieving. Interestingly, one of the first evaluations already talked about language, which I find really interesting. Again, it's a consideration for the whole of these projects going forward, which is around the PHA, which is public health approach. They actually found in their evaluation when speaking to people that there was a preference for a whole systems approach, because some people were confused by the language of a public health approach, and that people better understood a whole systems approach. Again, I just think it's interesting to reflect on this. In terms of the projects going forward, the language, sometimes when we request information from people, we do have to consider what it is we're asking for, because a lot of people don't understand what we mean by a public health approach. So this preferred terminology around whole systems approach is interesting. Don't worry, I don't expect you to read the flyer. It's just to give you an idea about some of that dissemination, which I think is particularly important for law enforcement and public health approaches, is to be really clear and transparent in some of the dissemination that happens from these projects. So, for example, for the VRUs and violence prevention, they talked very much about, and their projects are very much centred on working with young people under the age of 25. Interestingly, and again, I'd be interested to hear people's thoughts that are outside the UK on this. There was specific core functions that was required to achieve. So these were mandated within some of the guidance that was given to those that set up these violence reduction units, was around reduction in hospital admissions for assaults with a knife. And you can see a theme here around reduction in knife-enabled serious violence, and also reductions in non-domestic homicides. So again, just reflecting on some of the other softer indicators that we might see behind that. And certainly some of the violence reduction units are very clear on their messaging around this, about how they're ensuring some of the early intervention softer indicators are also measured and shared. So again, just understanding how this works as well. So the reason I've pulled out Bedfordshire, so as I said, there are 18 that have been set up. So Bedfordshire I pulled out very specifically because they were very overt, I suppose, in terms of how they named their violence reduction units. So they've all been called something slightly different. Some are violence prevention units, some are violence reduction units, and Bedfordshire have gone with a violence and exploitation reduction unit and have widened their remit to understand serious violence, particularly youth violence, can be much broader in terms of exploitation. And I could go into another whole presentation around some of the nuances between exploitation and violence within this. I'll save that for another presentation on another day. And again, was reflecting on Nick's question before to Munya about the differences. So even from a UK perspective, when we're talking about violence prevention, again, don't worry, I don't expect you to read, but it's just to give you a flavour. The Wales Violence Prevention Unit certainly has a real strength around the evaluation, are very clear on their evidence base, are very transparent in their reports, and are involved across all of Wales in a lot of initiatives and projects, and really have a core evidence base going forward. And the Merseyside Violence Reduction Partnership, which I've pulled out as well, very much centred on that life course and that public health approach to violence within Merseyside. So each of the violence reduction units, when you go onto their websites, you'll see a very slightly different slant on how they're approaching it, their remit, what they include in that. Personally, I think there's some real good things about having those different areas and the learning of that being brought together. Again, what's really interesting from a leadership perspective is that we have what's called the National Police Chief Counsel lead for serious violence, who is their responsibility for coordinating and bringing this all together as well, which again will drive that multi-agency collaboration going forward. So again, just sort of highlighting some of the interesting questions, I suppose, from this that you might have yourself. And again, feel free to put some of this on the chat, and I'm more than happy to discuss this after the presentation. So this potentially highlights that benefits of government funding, that real surge, powerful funding that comes in. Some questions might be around, are the targets appropriate? Initially, this was a short-term project. There has just very recently been additional funding for the VRUs, but they were working on a timescale that was relatively tight. Normally over 1 to 2 years, most projects at this magnitude are around 2 years funding. And again, understanding really what outcomes do we expect from a lot of the law enforcement and public health collaborations when they're funded over short periods of time. Are they going to be accurate in what they're assessing? You know, are they appropriate in what we're asking them to be reporting on? And again, asking the question, particularly from this piece of work, what about the other 25 police forces? Where is the learning for them? Is that being shared with them in a different way to enable them to put together some of that local collaborative working, and that's working really well in communities and enabling that community safety? And again, I mean, just on the UK, I promise we'll go into other areas in a minute. We have the safeguarding partnerships that already exist across the UK. So these are now required as a tripartite ownership across police, health and local authority. So that's mandated. They have to be owned jointly across police, health and local authority. There are a number of issues with this, which I'll just nicely highlight on this very complicated slide, about this idea that when we've already got safeguarding partnerships with responsibility for responding to vulnerable people in our communities that already have, for example, all of these policies and practices around vulnerability from a piece of work in South Wales. So if we already know all this complexity exists around vulnerability, and then we're creating new things on top of this, how do they all fit together is often a question that's posed around when we start to do community safety at a local level, regional, and then national level across that. And again, just moving on, a lot of this is linked to staff's sustainability as well. This is actually really important, and again, reflecting on a lot of research work that we've done. Again, linking, I suppose, to funding, most of these projects tend to have staff seconded. We know from a lot of work that's been done around multi-agency working and collaborative working that the staff and the workforce and sustainability are normally the key factors within effectiveness and seeing those outcomes through. So again, we've got a question about how do we ensure that we've got that sustainability going forward when we've got a workforce that is constantly changing. And again, I've reflected on this a few times in this presentation around some of the longer term impacts that we might not see in this lifetime. Where is that acknowledgement about some of the work will take a lifetime for us to really see the benefits around this, rather than trying to see some of the short-term benefits to continue some of that short-term funding going on for some of these projects. And then around universal services and support within the community. So just highlighting another project. I promise I'll fly through the last couple of bits so we've got time for questions. So Studying Europe, again, reflecting on some of the work that was done with them certainly before COVID, and I'm sure as we come out of COVID, some of the changes that will happen around this and some of the learning that's been taken from this as well, from projects that are working more locally. So STAD in Europe, and again, there's a link there for you to go and find some more information. They've got some great infographics, lots of very local. So they've got area profiles and reports from different areas that they've been working in across Europe. So it was a Swedish prevention strategy back in 1996. And it has shown some significant effects on the reduction of alcohol, over-serving, decline of underage drinking, and reduction of alcohol-related aggression. And some of the key components of the STAD model is around community mobilisation. So again, you're seeing lots of key themes here that we're starting to talk about that responsibility held within the community, and the success depends on that community drive and uptake. And it's seen as one of the key things in terms of the STAD model going forward, along with training within the beverage service, and also around stricter enforcements as well. I'm sure as we go forward as well, there'll be a lot more work that comes out of the STAD in terms of festivals and home drinking post-COVID. This is just a nice infographic I've totally stolen, and obviously reference from the STAD in Europe project, and you can see some of the great work in the areas that they've highlighted and worked in. So in terms of decreasing in violence, so they've seen 29% decrease of violent crimes in nightlife area, and also that legal age limit, that's now increased compliance for this going forward. There's also a really nice link, which is from the Royal Society of Public Health at the bottom, which is taking, I'm sure, some of this work and worked on a more community-centred approach to reducing alcohol and harm. So that community is in charge of alcohol. There's a really nice video there that you can go on, and it gives you a nice summary of the project going forward as well. And sort of last projects are sort of highlighted around that co-responder models that I talked about right at the beginning. So this is a recognition around that critical moment, so that 999 moment where we've got someone call in, there's an incident, whether it's a domestic abuse or a potential mental health issue, and how we can ensure we've got that collaborative, we've got that multi-agency response at that critical moment. There certainly seems to be acknowledgement across Western Europe that more needs to be done in that critical moment, with a decision-making driving every action from them. And about how this emphasises, again, reflecting a lot within this, again, whole presentation could be done around this, around adverse childhood experiences, how we can be more trauma-informed at that critical moment. So this is emphasising how we identify, understand and respond more appropriately at these critical moments. I've highlighted lovely little links there, which I will pass on to the presentation around some areas in England where this pilot's been done, some research that's been done in the Netherlands about how we can better collaborate. And then there's a really nice systematic review around police and mental health triage teams. Got to put my teeth back in. Which is a really great paper which talks about a number of studies that have been collected together and how there's still a lack of evidence about how effective that is. But this is mainly to do with the hours of operation and staffing and the responses that are available at those times. In terms of domestic abuse, I was actually really lucky to be involved in a project in Lancashire that's been nominated and won a number of awards in terms of their co-responder model. So a police officer would go out to a 999 call for a domestic violence incident with an IDVA. Some really great statistics that's come off the back of this, which is around tripling the number of victims that engaged in safeguarding, and tripled also the number of those that then went on to go to partake in criminal investigation or prosecution. Again, we know crimes like this, there tends to be issues around getting victims to engage. There's also some great work that we've highlighted around Finland, and a great project that's just in its second year at the moment, and with some final reports due, the Improdova project. Again, I've put some links onto there because there's a great number of evaluation work that's coming out of that. So that project involves a group of researchers from 8 countries, including Austria, Finland, France, Germany, Hungary, Portugal, Slovenia, and the UK, about this integrated response to high impact domestic violence. So it's certainly worth looking into that. And then last, to just sort of highlight here, because I'm aware that I'm just about on time, is, again, not just thinking about those critical moments in terms of our statutory responses a lot of the time. It's about how we can look at those critical moments, particularly for children at risk of exploitation, and provide a better response. So again, I put a hyperlink there into Red Thread. So Red Thread have done a voluntary organisation, and one of their initiatives is being centred in an A&E department for those young people that come in with, for example, knife injuries, and how they can wrap around that care for that young people. And they're seeing a lot of effective outcomes from having that non-statutory response at that critical moment. And last couple of things from me. Considerations going forward. Again, I'm going to keep echoing with a lot of their findings are around the recovery of communities and universal support, because COVID-19 has fundamentally changed all of societies across the world and exacerbated our most vulnerable populations, and has created this what we call perfect storm of adverse circumstances to these communities. Mental health populations in Spain, again, I've highlighted this in the hyperlink. What we know from a 2 and a 5 week study that was done at the point of going into lockdown, at the first lockdown, there was a real psychological impact on well-being, and loneliness with this significantly worse for those that were younger, and also for females as well. This has also been replicated in the UK with psychological morbidity more evident for younger and for women. So again, considerations going forward about what our community safety approaches need to be focused on. And I will reflect again on our workforce. A piece of work in Spain has talked around 28% of our frontline workers have suffered with major depression, with this being 6 times higher than in the general population. And reflecting on those of us that have been working from home, there's a really nice Royal Society of Public Health piece of work that's been done around how that's affected people working from home and that disconnection with colleagues going forward. And the last point is just around early intervention and prevention. There's been a real concern around that you've got an issue that all of that great work around early intervention has almost been lost, and it's about building that back up. And again, there's a really great hyperlink there to the Early Intervention Foundation, which talks around the impacts of school closures, social distancing, and how that's affected the abilities for services to support children and families when it is at the greatest time of need for them. And there is a real requirement now to get families back onto their feet and prevent these situations from getting worse. So last slide from me. I promise I'm finished now, Melissa. So what's really interesting, I suppose, there's lots of opportunities for growth. We've got this idea that multi-agency and whole systems approach is certainly what is driving things going forward. That we have got this idea of many hands make light work, but it needs to be the right hands at the right time. And the importance of evidence and evaluation right from the start and driving that out, but disseminating those findings going forward. And a wider acceptance of long-term work needed before those are realised. Systems and data sharing, I'm sure, is mentioned by everyone. There's a really great link there for a place called GraphNet, and it's a systems that's working particularly in the UK, which is joining up social care, health data, along with police data in some circumstances as well, about how we can better share some of the data on our vulnerable populations. Listening to our young people and vulnerability, and using that user-led initiatives going forwards, and reduction, certainly in overlapping strategies and policies on hot topics. I noted here that Munya talks about cocaine trafficking, and this is certainly one of the sort of key issues within the UK as a hot topic, which is around county lines. However, there's a lot of issues around. We've even got problems trying to bring together data across different areas in the UK, never mind, as Munya talked about, which is how this works on a global perspective, and some of the crosses that we've got in terms of safeguarding and investigations around this. So again, about how we focus on hot topics around, for example, county lines, when there's a much broader exploitation issue that sometimes sits beneath the surface. There are some dangers sometimes in creating profiles of what harm is, and then you lose those harms that don't necessarily fit that profile. And this is just a nice thing that I would suggest when I send the presentation out that you go to. The Connections and Wellbeing in Our Workforce and Our Communities is a really nice link. It's a 2-minute video which talks about the impact on our workforce, which undoubtedly also will affect our workforce, working with our communities as well. Workforce stability is seen as a key in effective partnerships and collaborative working. So we need to always remember that they should also be the centre of our discussions going forward. And there's also a link to the Oscar Keel work that's been done with emergency services going forward. That's it from me. I will stop talking now because I can see there's quite a few little chats on the screen as well. So thank you very much.
Thanks, Michelle. That's fantastic. And what I really like to see in your presentation is the extent of the government funding some of this work, which we see in some other regions. It's still very dependent on international donors. So that's setting a great example. We do have some questions in the chat, and Motsao, if you would like to ask your question, I could read it out, but I think it would be lovely if you would like to ask it yourself, if you're in a position to do that.
Hi, Michelle. Thank you for that. I'm Motsao, and I'm from South Africa. I was very interested in, and also especially about that money, lots and lots of money, the government gave. My question is just like, across your studies and the research that you have done, has there been anything around the brain? And I asked the question because that is, that's my pet peeve. I want to know, how can this happen? How can it end? How can the perpetration end in the brain? And for me, I'm curious to know, across your research, if there was anything that stands out or something about, how change happens in the brains of perpetrators of violence.
Good question. I suppose there's nothing that we specifically pulled out in this piece of work. However, I'm aware of there's a lot of work that has been done in this area, which is obviously done from a more sort of medical collaborative perspective. I suppose from an ACEs, so from the adverse childhood experiences, there's a lot more work that's happening now in understanding, for example, trauma on the brain and how that can affect people and their life trajectories. There's obviously quite a significant amount of work that's been done, in the UK, Western Europe, and particularly in America and Canada around this, around how those experiences can really have long-term impacts. But again, there's some dangers around some of this simplification in some of these models, sometimes around using frameworks such as ACEs and understanding. People often take shortcuts. We've got an obsession with risk assessments in society. We want to have a nice checklist because our jobs are so busy. So there's sometimes dangers in sort of saying, well, ACEs has got some evidence around sort of brain damage or brain impact or trauma impact, when actually it's much more complex than that. And there might be some resilience factors, protective factors, and some other types of more physical trauma. And I suppose there's a lot of work that's been done to understand the long-term suffering versus very chronic experiences around this as well. So I think it's certainly an area that's growing. It's not something that's come out within our studies that they've taken that very in-depth look in that, but there's certainly acknowledgements around how trauma can physiologically affect on people going forward, not just in terms of their perpetration, but also in terms of victimization as well.
Thank you so much.
No problem.
Okay, and we have another one for, actually just before Munya's, actually might have just dropped out. Munya, his battery, because he had some issues with the power, his battery may have just dropped out. So I think we may have lost Munya, so that's a shame. We're going to throw a question to him, but we will, if you have any other questions for Munya, we can pass them on, or you can email us and we can respond that way. But otherwise, we will go on for questions with Michelle. And There are a couple. Francesca, did you want to ask your question directly? Thanks.
Yeah, sure. Hello, everybody. And just very quickly, I have to leave at 11:30 because I've got another meeting, so apologies for that in advance. So thank you to both presenters because it's very, very interesting presentations. So I wanted to ask Michelle, so I've been looking at the work done by VRUs quite a bit recently, and I was wondering if you have noticed in your research whether there are significant or meaningful variations or differences in the work that the VRUs do locally, because obviously the idea is that they have to develop solutions to local problems, but very much the focus from the government was very much the same. So I was wondering if you could comment on that. Thank you.
Yeah, and I think it's a really nice point to make, Francesca. I think certainly we have seen very slight different focuses, as I sort of mentioned, and it's certainly worth using those hyperlinks to have a little nosy at the different focuses that they do have, and particularly, as I said, around Bedfordshire, we're purposely saying theirs is around exploitation rather than being around violence reduction, because some have commented on some of the serious violence criteria is too narrow, and actually there's a much broader remit, and that kind of also overlays with some of my own work that I've done nationally around looking at child exploitation, which is criminal versus sexual. They are seen very differently in terms of how they're categorized and how they're treated from an investigative perspective around that perpetration and unraveling that network of perpetration versus seeing that individual that's in front of you that might have a ton of drugs as a victim and safeguarding that person. So there are slight differences in how they're approaching that. And particularly what I would say is that, again, reflecting, and I can see Jackie Sabir, who's the MPCC lead, who I didn't know was coming today, I promise you, is the MPCC lead for serious violence in the UK, who's obviously got the lead around the VRUs. Certainly what I would hope that happens going forward with the additional funding that's happened with the VRUs is similar to what we're doing here in terms of global perspective. There's different perspectives and the different focus across all of those 18 VRUs is brought together, and we can really share some of that learning experience, because we have to understand in a place like Merseyside, which has got a real some issues, particularly I suppose in one of the big exporters, for example, around counter-lines and drugs, versus more rural areas that might have more neglect or more intrafamilial or poverty issues, for example. So there has to be some learning and how that can then be replicated and shared for those areas with similar profiles as well. But it's about bringing that together. So I do think there's something good around having a slightly different focus, but what's really important for me as a researcher is where is the learning and dissemination in that going forward for other areas, not just in the UK and Western Europe, but globally, to take some of that learning and going forward.
Now we do, yeah, thanks, Francesca. Now we do have, I'm not sure if it's a question or a statement from Jacqueline and Jane Townsley, but I think it would be great to hear from them. So Jacqueline, could you please go first with your insights?
Yeah, hi everyone. Hi Michelle. So brilliant presentations, and it's fantastic to see such great work being highlighted globally. Just to sort of go on the back of what Michelle says, so we are purposely evaluating both violence reduction units as a theory of change in its totality, but also the beauty of the violence reductions units are local, because they are locally devised to deal with local problems. And that was always very much in our outset what we wanted. So whilst there are certain prescribed things that they have to do, like a strategic needs assessment and a strategy, they are very much tailored to the local, but pulling out clearly really important learning around how to get the voice of young people involved, community participants, working with parents. And so we're looking at some key themes there as well. But my comment and my perspective really is, and I think something that both presenters have touched on, is the importance of leadership. This doesn't happen if you have not got that strategic buy-in. Even if you don't have the money, you can still make it work if you've got the right leadership and sustained leadership. So I think that's something really, really important to reflect on as well. Thank you.
I would just add to that as well. I mean, it's really nice for Jacqueline to be here today, so thank you. With some recent evaluation work that's just been done on safeguarding partnerships, just reflecting on that. We had a number of partnerships in the evaluation work that was done nationally, which is around, protecting vulnerable children, particularly around exploitation. And what we saw was those areas that had that additional funding, as was talked about before, 100 million and 35 very specifically for the VIUs, is a lot of money to really pump prime a lot of that community service work going on in those areas. But obviously we had some areas that were purposely not in that area and had to do stuff on their own. They had to create their own local initiatives, learning from some of that work. So, and what's interesting, just reflecting on what Jackie's just been talking about there, is leadership was key within that. What seemed to be really effective in working in that local area around effective partnership working was around sustainability and support from those leaders within that area that were at that directorate level to drive some of that change and to make people feel supported in being innovative in the way that they're responding to vulnerability. And I think that is a real key feature going forward, is ensuring we've got that workforce stability and people feel able to be innovative in creating solutions that are appropriate for their local community.
Thank you.
Melissa, I think I'm going to have to jump in. We're going to have to finish up, aren't we?
You can. I'd just like Jane to have...
certainly. Sorry. Yep.
And then you can go.
Okay, I'll be very brief. I put in the chat earlier on a link, and I just wanted to reinforce what Jacqueline had just said, that leadership is key. So the handbook that I mentioned, which has been developed with UN Women and UNODC, and I'm glad to say that Melissa, your very own Melissa, is one of our handbook experts. We hope to transform policing globally. It's being piloted in 22 countries. The focus is on police middle managers, that sort of police station, police district level, who often get neglected when there's reform or training. So the handbook is designed for them by police officers so that they can demonstrate, empower and enable them to show leadership. But it's absolutely critical that the implementation of this handbook is owned by the police themselves, which is the work we're doing at the moment. So I can't agree more with Jacqueline. There has to be the leadership. We can't just do tick box. It's not just a nice to have over here. It should be embedded in everything that we do. And just because we've got a lot of researchers on here and project leads, one thing we found very quickly when we were mapping for the handbook is there were so many projects, so much research, so much really good, some good practices, but there was very little evaluation of them. So again, often we have this, research done or project is done, it's really good, a report is done with recommendations and it sits on a shelf. So I think that is the missing piece globally, in that we have to transform what's said in research into the realities on the ground. So I'll be quiet now, Nick.
Well,
yeah, and that Jane was exactly one of the points I raised here, having just completed another national evaluation on safeguarding, very, very conscious of basically saying the same thing a number of reports have done. And the barrier is, how do we break through and change in practice? And what we're basically sort of being told is that make the changes locally to then drive the national agenda, which is a shame, but there's an understanding around the national perspective does take much longer to push through. But yes, I completely agree. We've got to be very aware of the research findings replicating the same things over and over.
I'm going to jump in because we really are running out of time. And thank you both, Jane and Michelle, for giving me the perfect segue, because that's exactly where I was going to go. We've had 6 international law enforcement public health conferences. If you look back over what's been presented at those conferences, there's a wealth of programs. There's a wealth of experience across a huge range of areas. I just looked, the people who registered for the Philadelphia conference, which was online, now have access to the recorded sessions. And just even looking at running through the sessions, we know so much. but I have had discussions in England, in America, in Africa, in all over the world, in Australia. We know what works. We have an enormous amount of evidence. I couldn't agree more that we need more evaluation and more evidence, but how do we bring about systemic change? I left Australia 6 years ago to live in the Netherlands, and coming back to Australia, I've come back to a very different scene. I've come back from what I saw as elements of progressiveness in policing and in the public health partnership to one that's become much more retrogressive. And Jane, it leaves the question about leadership could not be more important. We've actually had that as a theme in one of our conferences, that collaborative leadership as the theme. But how do you get good leaders, and how do you make sure that those good leaders, stay in the position to bring about systemic change? So I think this leads me to saying that this is not a one-off. This webinar, this research project is not a one-off. This is all part of a continuing enterprise and exploration by the Global Law Enforcement and Public Health Association. We won't have an international It will be in England. I should think we're still tying down details about that. Next year, there will be, I know the United Kingdom is having its 4 nations process, so there's a regional meeting going on there. We're planning a regional meeting in Australasia and hopefully Oceania. We've been talking about a similar regional meeting in Africa. So there's lots of opportunities going on, but can I encourage everyone who's here, who's not a member of the Global Law Enforcement and Public Health Association, have a look at GLEFA. GLEFA is increasingly working on the basis, as well as the regional focuses, of the special interest groups. And the discussion Motsau raised about brain injury and violence, for instance, we have a very active special interest group on neurodiversity and law enforcement, which is looking at issues around acquired and traumatic brain injury, amongst many other things. But there's a whole range of ways that people can get involved. So it remains for me to thank you all for coming. I have a number of people to thank: the Open Society Foundation, who provided support for this exercise, and in particular Mark Krapansky, our communications partners, without whom none of this would work, and Kerry and Anne and Tim in particular from Minus Communication. Thank you so much. Our own little organisation, Bill Stronach and Melissa, integral to the effectiveness of what we're doing, and others in the executive of this project, and in the discussions that are pushing this whole exercise forward, including Scott Burris, Arthur Van Dyke, Brandon Del Pozo, Mark Krapansky, Brendan Cox, and a whole range of other people who are being active in driving this forward. It's amazing to me that how much enthusiasm and response this exercise is getting. Not the exercise that we're looking at here tonight, but the broader exercise of looking at how do we structure responses to complex social issues? How do we guarantee community safety and well-being for the whole community? And these issues that are being tackled in different ways all over the world. And the last thing I want to do was to thank the researchers, all the research team, in particular tonight, Michelle and Munya, for your contributions. Munya, I see you back online. And heartily encourage you to join us with our next 2 webinars, where we'll look at, in each of them, at 2 further regions of the world. And I look forward to seeing you there. And please, if you have questions, please get in touch. We are committed to responding to them. Thank you, everyone.